The Diploma in Patient Safety is a 9-month course run by the college which aims to provide learners opportunities to understand the fundamentals of patient safety and how to prevent harm for patients in their care. It's a participatory course in which you undertake a project or learn from doing something back at the hospitals that you work in, and then to apply it in day-to-day settings.
I'm currently a staff nurse in Templestowe Children's Hospital. I've worked there 14 years on the National Renal Unit. There was a process on the unit I work in that I really wanted to change, and I felt from attending the Diploma in Patient Safety it would help me and guide me in making this change more acceptable, approachable and attainable. From doing this course from day one, I found things I learned I could implement the next day into my working day. Things like communication, active listening, adverse reactions, open disclosure, learning how to actually use all these on a day-to-day basis, learning it one day, bringing it back to work the next day, I found so beneficial from this course.
Prevention of harm is now fundamental. Patients understand that when they go to hospital, they've got a 10 to 15% chance of being harmed. Those figures in Ireland are very similar to the rest of the world. So one can't take for granted that one's going to prevent harm. One has to know how to do it, and the diploma allows you to learn about the theories of patient safety.
One talk that stood out to me on the Diploma in Patient Safety was a pilot who came into us. He showed us a video which showed how communication can go extremely wrong. This has taught me that I need to improve my communication skills, and by doing this it will hugely improve patient safety within the unit. Active listening is a big thing taught on the Diploma in Patient Safety, and I find now that I don't just read in between the lines. I will listen to what people say, I will interact back with them appropriately. One of the other things I took away, which is hugely taught on the Diploma in Patient Safety, is mindfulness. And I would have never given myself time, that little 1 minute, 2 minutes, just to get myself back on track. And I find myself, both professionally and personally, taking on board what I was taught in the Diploma in Patient Safety about being mindful and looking after myself. Throughout this course, there was numerous benefits. I made a great network of colleagues and friends who were always there to support me. Within the actual academic side of it, every day, if I had a problem, I could email, I could call, be it Jenny, who looks after the course, lecturers on the course. We had instant access to email, calls, text messages. They were always there to support you every step of the way.
It is said that, by Paul Batalden, one of the leaders in quality improvement, that everyone has 2 jobs in healthcare. The first is to do their job, like a doctor or nurse, and the second is to continually improve their job. And that's what quality improvement's about.